primary school, and my daddy is a police officer, and I like it when Joe Wicks is Scooby-Doo. Hi, my name is Lacey. Hi, my name is William, and we go to High Primary School. And I like playing with the marbles one. I like playing on the field with my friends. And my daddy works at the police. My mummy is a teacher.
I am Joshua, and I go to High Primary School, and my dad is a key worker, and my mum works for Boots, and I love the field. Whoa.
Hello, I'm Charlotte, and my parents both work for Nottinghamshire Police. My favourite thing that I've done at school so far is rounders.
Hi, I'm Leo, and my mummy and daddy work for the ambulance services paramedics. They take people to A&E when they've had an accident. I have been at school recently, and my favourite thing has been weaving Eye of God. Here's a picture. That's all from me, and this message is to say stay home, stay safe.
Hi, my name is Ethan, and this is my brother Johnson. My mum and dad work for the key workers of police force. Our favourite thing at High Primary School is rounders.
Thank you, County Council, for keeping us safe.
People, all the key workers who are working during this pandemic. Thank you, Mum and Dad and the school. My favourite thing is so I can play with my friends.
Me. Thank you for Miss Lowe, and thank you for Miss Smith. And we had lots of fun with belly dancing and painting rocks.
Thank you for keeping our school open. Mr. Bancroft and the cleaners are all fab. I'll have a lot of special memories here.
Thank you to Mrs. Thompson, Mrs. Pye, Mrs. Sheila, Mrs. Kayla. We've been painting, we've had ice cream, we've been outside, and we've even had Easter eggs.
Thank you for letting us in the school while my mummy cooks the dinners. We made fairy gardens, and we played on the bikes, and the teacher made it lots of fun, and we made lots of new friends.
My mummy and daddy work for the NHS. My mummy and daddy work for the NHS.
My mum and dad work for the NHS.
Our mum and dad work for the NHS.
My mum and dad are on the front line risking their own lives.
We want you to stay at home to help save lives.
We want to protect our family and would like you to protect yours.
This virus can kill anybody.
You may not have symptoms, but you could still be spreading the virus.
It's important to stay at home and help save lives.
In our foster family, we have 10 pets. They are 3 Westies, Saffron, Belle and Beau, 5 tortoises, Herbie and Bernadette, Amy and Sheldon and Penny, and we have the 2 rabbits who are Poppy and Daisy. And the fact that there is several dogs I find really helps, because we've got several children and everybody can have a cuddle at the same time and everybody can get that attention really. The children that we've had and young people that we've had have often spent more time with the dogs initially, because you can have a chat if you want to chat, you don't get quizzed, you don't get asked anything, and they're just lovely company. So this is what we call the den, and it's our semi-independent room, but this goes down really well. It's got its own entrance, it's got its own set of rules. It is somewhere to practice being independent but safely. We're all in the house, they've got access to the house all the time. I've got a key for the den as well, so it's still one home, but this is a separate area for privacy. We've got rooms in the house for younger, under 16-year-olds. This is probably my favourite and most important thing, and it's our welcome book. So we don't really discuss this book, it's just left on the child's bed, and in their own time they just go through it. But what is so important to me, because it introduces our family, there's photographs of everybody that's in our house, and a little bit about them as well, what things they like, how old they are. And I think that it's, in the early days, it can be so daunting, and it's who am I with, and it's actually really nice to have a little bit of an explanation, and they also can create talking points. Because food and meals are such a high anxiety area for nearly all of the children that we've had, I like them to know what's coming, and I like them to be able to plan and not worry about their evening meal. So we have a Monday to Friday system, and on Sunday I'll plan out what we're going to have, and they simply just tick their name if they want it. And I have found that since we've introduced this system, I'm not getting asked at breakfast what's for tea, because children were obviously concerned, they were asking the question, and it's there, they open it up, and it's really lovely because spaghetti bolognese always goes down really well, and on Sunday you can hear the little whispers, I can't wait till Wednesday. Before a new foster child comes to join our family, it is an anxious time, but I would say it's more exciting than anything else, and we've got a lot of trust in the county council for matching us to the right placement. So before that child arrives, we don't question, are they right for us, because we're confident that they will be. I would say to people thinking about fostering to ring the local authority and ask as many questions as you can. When I tell people I'm a foster carer, a lot of people immediately say, I've thought about that, or I want to do that, and haven't. And I'll always question, well, why did you not make that call, or why did you stop? And it's often a fear that could be just, I don't know what the word is. it could just be resolved so quickly, and sometimes just asking questions and makes you realise that the things you're worried about aren't really there, or you can speak to somebody that's experienced it and gone through it, and have come out the other side and think, actually no, it is a really rewarding thing to do. I can't see myself doing anything different.
My son Josh recently turned 2. After we moved to the area, I needed to find a new nursery for him. A colleague mentioned that the Knott's Help Yourself website had a list of approved childcare providers. The site was easy to navigate, and I was able to filter the search to my local area. Knott's Help Yourself was intuitive to use and offered me a wide variety of options. The site gave me access to a whole host of opportunities and provided me with a wealth of useful information. It was brilliant to see Josh settling in so well on his first day. I'm happy knowing he's well looked after.
Skull, my name is Magnus, chieftain of the Viking tribes of Pearlthorpe. You can't come to us now, but you can invite me into your school to teach your...
A warm welcome to this meeting of the Health and Wellbeing Board, which is being held remotely, with the majority of members joining the meeting from their own homes. This is the first virtual meeting of the Health and Wellbeing Board to be held in line with the new requirements of the Coronavirus Act 2020. Please do bear with us if you experience any technical issues. If we do lose any members from the call temporarily, then officers will seek to assist in getting them reconnected as soon as possible, hopefully without the need to halt proceedings. Officers will inform the meeting if they're unable to rectify the problem and if we need the meeting to be paused or adjourned temporarily. When participating in video conference, and I know a lot of people are very experienced in this at the moment, please remember mute your microphone when not speaking and avoid sharing any personal data on your screen. To assist with chairing the meeting, please use the virtual hand icon in Microsoft Teams to signify that you wish to speak. If you don't have this option, please use your real hand. And of course, the usual rider to that, when you finish speaking, please take your hand down. If we need to formally vote, where possible, I'll ask if anyone is against the motion. I'll then ask for abstentions, and then I will assume that everyone else is in favour. Before the formal part of the agenda commences, I'm required to ask county councillors if there are any substitutes present. The substitute will need to identify themselves and give the reason for the apology from the member who cannot attend. Martin, please.
I've been notified of one substitution, Councillor Harper, which is Councillor Butler for Councillor Purdue-Horan.
Thank you. Welcome, Richard. Anybody else from the County Council who is substituting? I'll take that as an assent. I'd like to take this opportunity to thank all key workers for the work they've done and continue to do so at this time of unprecedented challenges due to the COVID-19 pandemic. We've not seen a threat to public health of this magnitude since the Spanish flu pandemic after the First World War. Key workers have risen to the challenge in an exceptional way, which must neither be taken for granted now nor forgotten in the future. The term hero is a description that key workers well and truly earn for themselves every single day as they go about their work in such difficult circumstances. As well as the key workers present, who we wholeheartedly thank, this message is also a thanks to all key workers in the widest sense, not just to those in clinical or social care roles, but also to those who make their invaluable contribution to society in many other ways. We heartedly thank you all. Thank you. We'll now move to item 1 on the agenda to note the appointment by full council on 23rd of July, which was yesterday, of myself as the chairman for the 2020-21 municipal year. At yesterday's full council meeting, I was appointed as chairman of the Health and Wellbeing Board, and I look forward to working with all members to fulfil our strategy for the 2018-22 with the ultimate aim of improving the health and well-being of the people in Nottinghamshire. And that is noted. Thank you. Now move to item 2 of the agenda, the election of the vice chairman, and I now call for nominations for vice chairman of the Health and Wellbeing Board. Each nomination, of course, must be proposed and seconded. Could I have any nominations, please?
Yes, thank you, Mr. Chairman. I'd like to nominate Dr. Jeremy Griffiths as Vice Chairman, please, which is a role I'm sure he's very familiar with. Thank you.
Could I have a seconder, please?
Yeah, I'd like to second that, Tony.
Thank you, Joyce. So it's been duly proposed and seconded. Is everyone in agreement, please? Thank you. I'll take assent as everyone is in agreement. So Dr. Jeremy Griffiths will serve as Vice Chairman for the forthcoming municipal year, and congratulations to Dr. Jeremy. We'll now move on to item 3 on the agenda to note the membership of the Health and Wellbeing Board for the municipal year 2021. Members are asked to note the membership of the Health and Wellbeing Board for this year. A membership list is included on the agenda on your packets on page 1. The eagle-eyed amongst us may notice some members have been omitted from the list. This is due to limitations with the software used for compiling the papers, and we'd like to reassure those members they're very much as valued as those on the list. So we therefore wish to note the membership of the Health and Wellbeing Board for the 2021 as follows, and I'll now ask Martin to read it out, please.
Thank you, Chairman. I'll read the membership. So from Nottinghamshire County Council, Councillor Tony Harper, Councillor Joyce Bosniak, Councillor Glyn Guilfoyle, Councillor Francis Purdue-Horan, Councillor Kevin Rostance, who replaces Councillor Ben Bradley, who was previously on the list, Colin Pettigrew, Melanie Brooks, Jonathan Gribbin. From Ashfield District Council, Councillor David Walters. From Bassetlaw District Council, Councillor Susan Shaw. From Broxtowe Borough Council, Councillor Colin Tideswell. From Gedling Borough Council, Councillor Henry Wheeler. From Mansfield District Council, Councillor Amanda Fisher. From Newark and Sherwood District Council, Councillor Neil Meisen. From Rushcliffe Borough Council, Councillor Debbie Mason. From NHS Bassetlaw Clinical Commissioning Group, Idris Griffiths. From NHS Nottingham and Nottinghamshire Clinical Commissioning Group, Dr. Jeremy Griffiths, David Ainsworth, Dr. Tillan Bartholomews, Fiona Callaghan and Lucy Dadge. From NHS England and NHS Improvement, Oliver Newbold. From Health Watch Nottingham and Nottinghamshire, Sarah Collis. And from the Office of the Nottinghamshire Police and Crime Commissioner, Kevin Dennis. And that is the full membership, Chair.
Thank you very much. That is noted. Sarah Collis, you've got your hand up.
I've taken it down, obviously, because it was relating to your earlier comment on membership. So that's been ratified by Martin. Thank you.
Thank you very much, Sarah. We'll now move on to item 4 of the agenda, which is minutes of the last meeting held on the 4th of March. That seems a lifetime ago, early March, before lockdown. Everyone should have received the minutes on their pre-read. Is there anyone not got sight or not had a copy of the minutes, please? Councillor Bosniak, Joyce?
Oh, sorry, Chair. It wasn't about the minutes, it was about the membership. And I'd just like to see a complete list of membership as an appendage so people can see who's actually participating in this Health and Wellbeing Board. I don't think we've ever really done that before, and I think it might be a good idea to start that. And also, I apologise that you've lost me again visually, because for some reason this machine doesn't like the look of me for more than about 5 minutes. So once again, I'm now incommunicado, or whatever the word is. Right, but you can hear me all right, and that's all that matters. Thank you.
Yeah, thank you, Joyce. Please be assured we like to see you, even if your computer doesn't. I'll just check with the officers. Is it possible to email the membership? Yeah, we'll email that round. Thank you very much, Joyce, for that suggestion. It is a good idea. I'll get the officers to email it round so everyone's got a copy. Everyone in favour of the minutes? Thank you. We'll move on to item 5, apologies for absence. Martin Gately will provide the apologies. Martin, please.
Thank you, Chairman. So I have apologies from Dr. Jeremy Griffiths. This is a clinical day for him. So.
Can I just say that
Jeremy, you're in the call. Okay.
I'm just dialing in for the first opening sections. I'm probably going to have to go as soon as I've got any clinical commitments.
I was just giving you apologies and saying how difficult it was for you to attend today, but it's great to see you. Okay, so Dr. Tillan Bartholomews, Lucy Dadge and Kevin Dennis have all given their apologies. And as I mentioned before, Councillor Butler is substituting for Councillor Francis Purdue-Horan today as well. And that's it from me, Chair, I think, for apologies.
Thank you, Martin. We'll move on to item 6, declarations of interest by members and officers. Do any members or officers present have any disclosable pecuniary interest to declare? And do any members or officers present have any private interest, pecuniary or non-pecuniary, to declare? And as I always say at this point, if you move on to the agenda and you find items that you've suddenly realised you have, that's not a problem. Just shout up and we'll deal with it then. But my question now is, does anybody knowingly have any? I'll take that as no, thank you very much. We'll now move on to item 7, COVID-19 local outbreak control plan. And you'll find this on pages 11 to 74 on your agenda pack. The purpose of the report is to appraise the Health and Wellbeing Board of the Nottinghamshire COVID-19 local outbreak control plan. Jonathan Gribbin, who's the Director of Public Health, will provide an overview of this item that will include a Microsoft PowerPoint presentation that will come up on your screens. With the transmission of COVID-19 in the community now at a lower level, focus turns to the early identification of clusters of new cases and quickly containing outbreaks as soon as they arise. The upper tier local authorities were notified by the government that they should prepare a local outbreak control plan by the end of June 2020 to complement the national delivered test and traced arrangements. The Nottinghamshire County Local Outbreak Control Plan, which you'll see at Appendix 1, was published online on Tuesday the 30th of June. The purpose of the plan is to ensure that the rate of COVID-19 transmission in Nottinghamshire is kept under control. Implementation of the plan is overseen by the Director of Public Health, working closely with Public Health England, district and borough councils and the local resilience forum. Daily surveillance and action planning is overseen by a COVID-19 protection board, co-chaired by the Director of Public Health for Nottinghamshire County and Nottinghamshire City. Political leadership in Nottinghamshire County, which of course is separate to Nottingham City, is exercised through an outbreak control engagement board, which I already sit on. The first meeting of the Nottinghamshire County Outbreak Control Engagement Board took place on Monday, 29th of June. This obtained agreement between partner agencies to the local outbreak control plan before submission and sign-off by the Joint Biosecurity Centre. The second meeting of the engagement board took place on Monday the 13th of July. Nottinghamshire County Council has been notified of an allocation of £3.8 million, which is ring-fenced for the purpose of COVID-19 local outbreak control. The recommendation is on page 13 of your agenda pack, which is that Health and Wellbeing members support the implementation of the local outbreak control plan. Jonathan, please.
Good morning, everyone. It's nice to at least see you on the screen again after so long, and glad, Jeremy, that you're able to join us too. Thank you for standing as deputy chair, and you just missed hearing yourself appointed to that earlier on. The purpose then, as the chair said, of this presentation is really to gain your support for the implementation of the local outbreak control plan across the county, which is something we're going to need to continue to sustain over the next 12 months or so. And the presentation that my colleague will put on the screen in just a few seconds' time will take us through 2 or 3 different things. First of all, we'll take a look at what the current situation is in Nottinghamshire, so that you're clear about current context locally. I'll then spend some time taking you through what we were required to produce in terms of an outbreak control plan, and some of the arrangements around that, and also mention some of the ongoing work. And then I'll finish up by just coming back to some of the key messages around this. Before I dive into that, I wonder if I might just add a further comment and acknowledgement at the outset. I think we're all aware that for most people, coronavirus is a relatively mild disease, but that for some people it has had a severe and tragic consequence. The report itself, at the time of writing the report, set out that there were about 650 people in Nottinghamshire County who had died as a direct result of coronavirus. And of course, we're all aware that behind those statistics lie a human story and a burden of grief for individuals and loved ones who've lost family members and friends. And I think an online meeting might not be the best moment for it, but perhaps I'm looking forward to the moment when we can actually meet together again, and it might be appropriate at that point that we take a minute or two just to remember those who have died as a direct result of coronavirus in Nottinghamshire County. But turning to the presentation itself then, Ed, perhaps you could move us on a slide. I've covered the things that I'm going to talk through now. If you move it on again, please. This next slide that will come up will be, the detail on it will be indecipherable. Don't be troubled by that. I'm going to talk you through the main features, because what I want to do initially, before talking about Nottinghamshire, is just to provide a bit of national context around what is happening at the moment in terms of coronavirus. And of course, we're familiar perhaps from the national media that as things stand across the country at the moment, we are at what is referred to as alert level 3. And that means that COVID-19, it's in general circulation, but we're in a situation at the moment where there's no overall increase in transmission if we're looking right across the whole country. But what we do need to note is that that alert level also indicates that significant local outbreaks continue. And of course, we're familiar with some of that from the news in the East Midlands, down in Leicester, and now increasingly in some other areas of the country too. The table on the right-hand side that you will be barely able to decipher because the print is so small is taken from a daily situation awareness report that I receive, which provides information to me about the local authority areas which are receiving most attention nationally from the centre. And what you won't quite be able to make out now is that at the very top of the list there, Blackburn with Darwen is listed, and it's at the top of the list because there are 3 or 4 indicators there which are of particular concern. One of those relates to simply the number of people now being tested in Blackburn, which of itself, the fact that it's high of itself isn't a bad thing, but is an indicator of activity there. But we also find in the data there that will be hard to read that that actually a high proportion, a relatively high proportion of those being tested are being found to be positive, and that the incidence in the population of new confirmed cases is also relatively high, and that's the column in the middle of the table there that you see marked out in red. Over on the right hand side, you might just be able to discern that it mentions as well that there are within the last week or so 2 further community outbreaks within Blackburn area, and right over on the right hand side that that local authority area is at the moment subject to some enhanced support from the centre. Now, I'm sharing this table with you just to provide a bit of context around Nottinghamshire. If I was to draw your attention to the very bottom line of the table, it would highlight the average for England, and that would show you that the daily incidence for England as a whole, taking this as an average over a week, is about 1 per 100,000 of the population. And if I was just to take that single statistic and make a comparison with Nottinghamshire County, our daily incidence rate is currently just a bit under 0.6 per 100,000. So if we compare ourselves with national average, we're currently lower than national average. And of course, if we compare ourselves with these local authority areas, which are the subject of most attention because of the possible concern that they represent, we're in a much better situation than they are at the moment. Nevertheless, this table provides us a clue about some of the indicators that we need to be tracking and managing in order to make sure that Nottinghamshire County stays that way. So as I'll come on to later on, some of the things that we're looking at within the team, within the outbreak cell, I should say, are keeping an eye on what is the rate of testing, what is the incidence rate of confirmed new cases, is it going up or down, and what are we seeing across the county in terms of community outbreaks. Next slide, please. So what I'm going to take you through now is a couple further slides now, which are taken from the weekly surveillance report, which the County Council is now publishing and putting in the public domain. It's on our website, and I think Health and Wellbeing Board members should last night, I think, have received a version of this report. So again, please bear with me. The fine detail on it you won't be able to make out, but I want to draw your attention to some of the main features. In the middle of the screen, you'll just about be able to make out in the blue and orange bars an indication here of how many people have been confirmed as having coronavirus, running from March right on the left hand side of that bar chart over to middle of July on the right hand side. And what you can see here in terms of the numbers of new cases is that it reached a peak in middle of April and has been declining since then, and now finds itself happily for Nottinghamshire at relatively low levels. You might be wondering why some of it is in blue, some of it is in orange. The blue bars indicate broadly people who've been tested in an NHS environment. That might be hospital or primary care very often. The orange bars overlaid on top of that, which we see coming in from kind of middle, late April onwards, are people who've been tested in a community environment. So, for example, through the sorts of drive-through testing that we've had available to residents in the city, and also based out in Mansfield, and latterly briefly in Bassetlaw as well. So that's that's a picture then of all of the confirmed new cases that we've seen over a 4-month period in Nottinghamshire County. And you'll see over on the bottom left-hand side that amounts to about just over 3,000 new cases in that whole period. If we were to look further down at the bottom left-hand corner, it'll tell us that in the week from the 13th of July to the 19th of July, there were a further 26 cases. So that just underlines then that although that's something that we need to manage, in overall terms, relatively speaking, the number of cases now is much lower than it was just a couple of months ago. Now, I won't go into the fine detail of these other bar charts, but just to say that these pyramids that you see at the bottom of the screen are providing an age breakdown of people who have been tested positive in an NHS environment on the left-hand side, or who've tested positive having attended in a community environment on the right-hand side. And the main feature there that comes out straight away is that people who've been tested in an NHS environment, the vast majority of them were older people, and many of those over the age of 80, whereas people who are being tested in a community environment, as you might expect, are spread much more evenly across the age groups. It includes some older people for sure, but it also includes a lot of people of working age. Next slide, please. So the weekly surveillance report that we sent out last night also includes this information, which really is drilling down just a little bit into, well, what's the picture within Nottinghamshire County? And over on the left-hand side, again, still dealing with total number of cases in the whole period from late February through to middle of July, we can see the breakdown of cases by district, and also breaking down Pillar 1 and Pillar 2. So those tests conducted in an NHS environment and out in a community environment. If I draw your attention for a moment or two then to the bar chart at the bottom right-hand side of this screen, in very fine text that you won't be able to make out, you would see that actually this is describing how the different districts compare in terms of the rates of confirmed new cases across that entire 4-month period. And over on the left-hand side in grey, you might just about be able to discern Ashfield, whose rate is pretty much bang on the same as England average, and next to it, Bassetlaw, whose rate is just above England average, but actually it's so close to England average that a statistician would tell us that it's not significantly different from England average. And then each of the other districts across the county, and they are significantly less than England average in terms of their total rate on a cumulative basis across those 4 months. The chart above that gives us a little bit more detail, which is quite helpful to see, because of course the question you might ask is, well, Jonathan, that's all very interesting to hear. what was going on across the 4-month period, but actually what's the situation now in the last couple of weeks or so in the county? What's happening now? And the right-hand side of this bar chart tells us some of that. So across the horizontal axis here, we see time, again, running from late February right the way through into middle of July. And on the vertical axis, we see the rate of, sorry, the cumulative number of cases per district. Actually, we need to change that and make it more clear, expressed as a cumulative rate. And the important thing to note here is that for each of these lines, each one of which represents a different district, although they were climbing mostly through May and in Bassetlaw even through June, what we see in the last couple of weeks is that all of them have flattened off. Now, that's a good thing. That means that day by day, we're seeing very few additional cases added to the total number in Nottinghamshire. And of course, what we'd most like to see and look forward to is the day when we don't see any being added to any of these districts at all. And that's what we need to monitor carefully. And then finally, Ed, if you can move me on to the next slide. Oh, I beg your pardon. I seem to have missed a further slide out, which is an error on my part. You will find that a further page in the report that we sent out provides some of that information, but drills down into down to neighbourhood level. And I could perhaps bring that back to you for a bit more explanation at a further date. But it's the same data, looking over the 4-month period, and looking instead at smaller neighbourhoods, so breaking down districts into some neighbourhood areas, and then picking out which of those neighbourhoods have been impacted most by coronavirus over the last 4-month period. And you'll find that in the report that we sent out last night. That's really the update that I was wanting to bring, and about the situation in Nottinghamshire. And in summary, I'd want to say that the overall situation in Nottinghamshire remains more favourable than in many other parts of the country. That's not to say that we can somehow sit back and ease off. As I will remind you at the end of the presentation, it's absolutely critical that each individual, household and organisation plays its role in stopping the spread. Nevertheless, at the moment, we are in a relatively favourable position compared to the rest of the county. So I'm going to turn now to some of the arrangements that we've been asked to put in place to make sure that the county stays that way. And that's really what the government required upper tier local authorities to do in terms of putting in place local outbreak control plans. And this local outbreak control plans fits into the wider context of what the government has put in place. And that's summarised really in these 4 circles over on the left-hand side of the page. So some of what the government has been doing is putting in place facilities to test for coronavirus, and to do that at scale, and to develop that into a system which in due course will be really effective. Alongside that, it has also put in place arrangements to follow up and do contact tracing so that we can identify, alert and support local people who need to self-isolate. So that's the test and trace that you will have heard a lot about in the media. Rather more behind the scenes, it's also done a fair amount of work. It's labelled up here as enable, to make sure that our knowledge of the virus improves over time, that we understand the things which shape its distribution in the population, and that we bring forward evidence about that to inform all of the decision making that goes on a national level. So that's under the enable. The contain bit is really very much more about using all of this information to contain what are described here as flare-ups at a local and also at a national level. And that's where the local outbreak control planning comes in. Chair, I can see a question here. I'm just wondering whether I might keep going with the presentation and maybe take questions at the end, unless someone's got a problem of a technical nature.
Could you carry on, please, Jonathan, and then we'll pick up the questions at the end if everybody's okay with that.
Thank you. I'll keep going. So next slide, please. The local outbreak control plans then that we were asked to develop for the end of June address these 7 themes. The plan that we've pulled together addresses arrangements for dealing with local outbreaks in settings like schools and care homes, and also other contexts which we identify to be particularly complex or in some contexts, in some situations, even high risk. The local outbreak control plan also has to set out how we will deploy testing locally where that might be needed. For example, in deploying and making sure that, as we did recently, that residents in Bassetlaw have really good access to testing. It also sets out under number 4 here how we might undertake contact tracing locally in some of these more complex settings. It also addresses some of the data that we need to undertake this surveillance on a daily basis. It sets out too how we will provide support for people who are made vulnerable by the need to self-isolate because they or a household member have symptoms or have found to be have tested positive. And then finally, the outbreak control plan also sets out some information about local engagement boards, and this is about the member-led governance and oversight of local outbreak control planning. Next slide, please. So this slide speaks to some of that governance which I've just mentioned. Slightly confusingly, the centre has introduced some different terms as they've gone along for essentially the same thing. I want to draw out for you that one of these circles, the top left one here in the diagram, underlines the really important role that the Local Resilience Forum plays in local outbreak control planning. And from the outset, the county has undertaken our local outbreak control planning jointly with the city. And I think that's important because it adds to the effectiveness of what we can do immediately. It adds very much to the resilience and sustainability of what we must do over the next 12 months. And of course, you'll be aware that coronavirus doesn't particularly observe local authority boundaries, and it's important that we remain joined up, not only with Nottingham City, but with other local authority areas as well in what we undertake. The bottom circle relates to something called the COVID-19 Protection Board, which we've also set up. In Nottinghamshire, that's just met once so far. At the moment, that's an officer-led group and is providing some oversight for the work that takes place on a daily basis by the outbreak control cell, which I'll mention, say one or two more about in a moment. This other circle here just re-emphasises the key role provided by the engagement board, or what here is called the local outbreak control board. In the Nottinghamshire County, this is chaired by the leader of the council. As Tony mentioned earlier on, the chair of the Health and Wellbeing Board and chair of the Adult Social Care Public Health Committee is also a member of this board, together with the deputy leader of the county council, 2 leaders from district and borough councils to ensure that there's a strong voice from districts and boroughs. Andy Haynes, who from the Nottinghamshire Integrated Care System, myself, Anthony May, the Chief executive of Nottinghamshire Council, and I think I've forgotten one or two other officers who are involved in that. That board has met twice so far and will meet again next week, and provides leadership across Nottinghamshire County around this outbreak control, and would also act as one of the channels through to ministers if a situation developed in Nottinghamshire County that required the exercise of more extensive powers, and I'll mention some more about that shortly. Next slide, please. So this is a slide to prompt me then just to say a bit more, working from the bottom of the diagram up, about what is happening on a daily basis. So we have mobilized an outbreak cell within the overall response structure of the Local Resilience Forum. That outbreak cell brings together colleagues from public health, environmental health, and infection prevention control colleagues from the local NHS and some other officers as well. And that performs two functions. On a daily basis, it's reviewing all of the surveillance information that we have about what is happening in Nottinghamshire at the moment. Looking at that, it identifies whether there is anything to indicate whether some further investigation is needed, or in some cases, whether some action needs to be taken. For example, where there may be indication that we have what may turn out to be an outbreak in a particular setting, it would be that daily outbreak cell which would mobilise the team, which would need to be brought together from across different organisations to do that. So if something was occurring in a workplace setting, for example, the outbreak cell would convene an incident management team that would draw together representatives from that workplace, from public health, environmental health and others, to undertake that work. That daily work is overseen, if I move up this diagram, by the oversight which I described just a moment or two ago. There is also arrangements at a more regional level to make sure that we're paying proper attention to what is happening on a regional level. And of course, as Director of Public Health, I'm very interested to keep a close eye on what is happening in South Yorkshire, for example, as well as in Leicestershire and in other neighbouring authorities. And of course, ultimately, this feeds into work at a national level, both in terms of political oversight, but also in terms of the Joint Biosecurity Centre. That's the JBC that you might be able to see referred to on this diagram, who also provide some support, and I think increasingly will exercise some assurance over what is done at a regional and local level. Next slide, please. So finally, I want to make a couple of comments around, first of all, some terminology, and then bringing this back to something a bit more contextual, and that will draw our attention to local lockdown, as it's been referred to in some contexts. Over on the left-hand side, there's a very helpful prompt here, which just helps us to frame for ourselves more clearly what we mean by an outbreak, because that word is used in slightly different ways in different contexts. Very often the daily outbreak cell is looking at information which frankly relates to sporadic individual cases. And the trick for us often, with the help of the information provided to us from the National Test and Trace system, is to discern whether those are all simply isolated individual sporadic cases, or to what extent they may be able, they cluster together in an identifiable way. In other words, where there is some evidence of a link between them. An outbreak technically is where you've got two or more cases with evidence of a link. So where we talk about outbreak, in some contexts, actually what we're referring to is just 2 cases with evidence of a link. In other contexts, we find ourselves, or in the media, drifting into referring to something much more widespread. And we just have to bring ourselves back sometimes to check, are we talking about something very small here or about something very widespread? And that really picks up the final bullet point on the left-hand side. What we are concerned to manage in particular is widespread community transmission, where you've got linked cases on a very extensive scale. Over on the right-hand side, the scrutiny and assurance that is being exercised on a national level is really making this distinction between business as usual, which is the kind of surveillance and action which I've described that our our outbreak cell is undertaking on a daily basis, and that's what the majority of areas in the country will be working to most of the time, and that is where we are at the moment. But centrally, the Joint Biosecurity Centre is also identifying what they would refer to as areas of concern. So these are, for example, the local authorities that were on the list that I referred to in or some of the local authorities in the table that I referred to right at the start of this presentation. And that's where the local area is undertaking targeted actions to reduce prevalence. For example, undertaking additional testing. The next level up in terms of the escalation, they would identify areas of enhanced support. So Blackburn with Darwen at the moment that you've heard about in the media is currently an area of enhanced support. And then at the highest level of escalation in terms of their oversight and assurance, they would refer to areas of intervention. And Leicester has been an area of intervention where additional measures and some direct intervention and support has been provided centrally, and input from the Secretary of State there. So that provides some context for talking finally on the last slide. You're almost there, colleagues. Talking a little bit more about the additional powers which are being made available now for managing situations which can't be properly controlled within the sort of the business as usual arrangements. And I think I want to summarize this by saying that it was just a week ago that some outline guidance was provided to us, and that was followed up earlier this week by a bit more detail, which describes that in addition to some of the powers which districts, boroughs have exercised and routinely have exercised for many years, there are now in addition some further powers that are being provided to the Secretary of State and also to upper tier local authority areas. Now, if I focus for a moment on those that are being provided to upper tier local authority areas, and the second bullet point here, you'll see that we're being given powers to, where needed, close individual premises, outdoor places and spaces or specific events, and that we'll be able to exercise those powers without going to a magistrate. There are some fairly specific constraints around how long those powers or those directions will endure for, and there's provision and arrangements there whereby we have to go back to get those renewed should those be required. But what this would allow a local authority to do would be, for example, if we found that that there were people who were congregating in a particular space, it would enable us to close that public space in advance of them congregating. We are currently just working through the practicalities of how that would be applied, and the realities of how that would be enforced. And we will be in touch with colleagues in districts and boroughs, and also partners in police in due course when we've got some further definitive guidance around that to share. The powers to close down a larger geographical area or a whole section of the economy, for example, food production facilities more generally, those powers exist but are being reserved for the Secretary of State to exercise. So those powers to exercise lockdown on that kind of extent are being reserved for the Secretary of State. And that was as much detail as I was wanting to share on that for the moment. I'm aware that I've attempted to cover an extremely broad range of things there, and that there may well be a number of questions to dive into detail which I've been unable to cover. So, Chair, perhaps I could hand back to you, and I'd be happy to take questions with your agreement.
Yeah, thank you, Jonathan. That was very informative. Before I introduce the 4 speakers that have notified, could I ask if you could email a copy of the PowerPoint presentation to all members, please?
I'll certainly do that, yes.
Thank you very much. So I've got Councillor Guilfoyle, Councillor Tideswell, Councillor Bosniak and Sarah Collis in that order. So Councillor Guilfoyle, please.
Thank you, Tony, and thank you, Jonathan, for the presentation. Can I just start in saying, again, what you started with, Tony, that our thanks and gratitude to all the workers who have been out there, carers, teaching staff, everyone who has, contributed to ensuring that daily life can continue for certain people, and also our key workers. And also to Jonathan and his team that have worked, I know, very long hours and very hard during this particular period. Thanks, Jonathan, as well for the report that you've just given me. You very succinctly, I think, took us through a 40+ page document very nicely. I want to go back to, though, is the surveillance report that, again, is a very simple model for just pointing out to people things. And I know from looking at and this is one of the problems of giving members data, because, you look back. I had a look back at the previous one. And then I've compared that to the one that we've got now. And clearly members will know I'm from Bassett Law, and looking at the areas that are in the super output areas, a lot of those actually lie within my county seat. The ones that are up there, such as Kilton, Cheapside, part of Works Up South as well. And the issue for me, in one sense, is clearly a week ago we had the additional testing facility that was put in for 3 days. But when you look at the graph, although it's very small in numbers, there is a slight increase in Bassett Law. And in fact, if you look at the first one on the cumulative cases, we were just below in the previous week, below Ashfield. We're now, if you look at it, slightly above, and the direction seems to be possibly going up May level. It's looking like, and also as it look on the chart, it's a very slight increase, as I say, in numbers when you look at the bar chart as well. And I just wondered if you are considering bringing back the testing facility again, and also whether you can tell us how successful that was in relative terms.
Thank you, Councillor Guilford. Jonathan, please.
Thank you, Glyn. Yeah, you're quite right in the observations you make that whereas I'd like to be able to tell you that day on day, week on week, there are nil new confirmed cases in the county. You're quite right. They're at a low level, but we are still seeing new cases, 26 as it was last week. So those lines that we referred to earlier on, they're not quite flat. We'd want to get them. We look forward to the time when we can make them flat. I am aware that for Bassett Law in particular, although the the number of new cases now is lower than it was back in May, June time, that we do see new cases still in Bassetlaw. And I'm also conscious of its proximity to areas in South Yorkshire, where actually the incidence is considerably higher. So that is something that we're watching really closely. The message I need to come back to is that the way that we need to manage this is by each of us individually and in our households and in our organisations observing that social distancing. I think I somehow truncated that off that version of the presentation. So observing that social distancing, that we keep going with that hand hygiene, that frequent rigorous hand washing, the respiratory hygiene around catching it, binning it, killing it, and social isolating where we self-isolating where we have or someone in our household has symptoms and getting ourselves tested. To your point about bringing back testing in Bassetlaw, yes, what we're looking to do is to make sure that every area of the county, residents everywhere, have ready access to testing so that if they have symptoms, distance and travel is no obstacle to them to getting tested really promptly. In terms of our experience up in Bassetlaw, over the 3 days last week where the mobile testing unit was based in Worksop, there were a total of 283 people who attended for testing. We're not able to separate, in terms of those results, we're not able to separate out those 283 people from other people in Bassetlaw who may have attended elsewhere. But what I can say is that so far from the results that we've seen, there was nothing in that data to cause us to have further concern for the time being about the incidents in Bassetlaw. That's not to say we should take our eye off the ball, and we won't. But there was nothing further at this time to give us further cause for concern. So we continue to watch that very carefully.
Thank you, Jonathan. The next speaker is Councillor Tideswell, please.
Thank you, Chair. Good morning, Jonathan. Just if you could confirm for me, I'm so pleased to see that at last complex settings having extra input and backup. My main concern has been the extra pressure that has been put on heads of schools. I know at the beginning there was a lot of pressure being put on them. The class were being responsible for the health and well-being of the pupils. And I was wondering, that is why I think it's more important that heads are informed, not just the academies and foundations. It would also relieve the pressure from the heads and also be able for them to use the information to reassure mums and dads that it is safe to send them back in September. Especially if there is, say, at the end of a phone call, the heads can actually then rely on clinicians' input, rather than expecting the teachers to be masters of all professions. The other thing I want to briefly touch on is we had an example regarding Bramcote Park, which is a local park near us, where somebody decided to hold a promptu wake. And there was over 100 people there. Police were informed, but unfortunately they were very limited to the amount of what they could do. These things have been cropping up. So I'm hoping that this now will help to resolve a lot of the local issues. Thank you, Jonathan.
Tony, Chair, shall I?
Yeah, please carry on, Jonathan. Yeah.
So thank you, Councillor Tideswell. Briefly then, a comment around the policing of gatherings like that. Yeah, I think this is really challenging for police partners. I think they've done I think they've done a fantastic job in Nottinghamshire of striking the balance between enforcement and persuasion and encouragement, and that's very much the approach that that we want to support them with. It's about informing people about how to stop the spread in Nottinghamshire, trying to persuade and encourage people, and taking a very careful approach when it comes to enforcement. But of course, where local people, and we do rely very much on district and borough colleagues for this kind of thing, where there is local intel about that kind of thing going off, then that's really important to feed in. To your comments about the pressures facing school leaders, yes, I think school leaders have found themselves hard pressed in many ways over the last few months, and many have done a fantastic job, I think, in keeping so many of our schools open to children of key workers, and it may be that Colin Pettigrew, Chair, if you, in a moment or two, might speak more to that. I was pleased with the help of Colin's team to be able to address, well, I think it was several hundred head teachers from across Nottinghamshire County last week, to talk them through the situation as it exists at the moment, to share with them some of the evidence around the spread of coronavirus amongst children and young people, and that actually the emerging evidence points to that children are relatively less hazardous than adults, frankly, in terms of the spread of coronavirus, in terms of the emerging evidence, but also what head teachers can do in their schools to keep their staff and their children safe. And with the help of Colin's team, I'd be pleased to strengthen that and come back to that early in the new year to make sure that our head teachers are really well supported.
Thank you, Jonathan. Corporate Director for Children, Colin, would you like to add to this?
Yes, thank you, Chair, and thank you for the opportunity. Councillor Tidswell, within 3 working days of the announcement of all schools being closed, I personally held 9 one-hour briefing sessions with over 200 head teachers, and we've repeated that every few weeks. One of the things that we did is that schools have been grouped together into families of schools so they could offer mutual support and mutual help. They've had some really difficult points, not least of all the just sheer volume of guidance that was coming out from the Department for Education, often at the 11th hour, often over the weekend, and often contradicting previous guidance. So we've worked very closely with helping schools interpret that, and we've done an almost daily bulletin to schools that is a frequently asked questions approach, and we're up to number 60 of those bulletins that have gone out, and Jonathan's right to have covered the content of his sessions with well in excess of 200 head teachers last week or the week before, Jonathan, and the reassurance that they took from that and the feedback that we received from head teachers on that was very strong.
Thank you, Colin. The next speaker is Councillor Bosniak, please. I realise you've got a problem with your camera, so if you just do it audibly, please, Joyce.
No, that's fine. I'm getting used to it. Well, just a couple of questions. A question that I asked a little while ago, Jonathan, was when we looked at the list for the neighbourhood breakdown of COVID incidents, near the top was Newgate and Carbank, and I asked whether they were Mansfield wards, or it's a Mansfield ward, because all of the others seem to be Bassett Law and Selsdon. This was the only one that I could identify as potentially a Mansfield ward. Were you able to check that out? There isn't a Newgate and Carbank in Worksop, is there, Glyn?
No, it's in Ravenshead. Ravenshead, the ward, as I understood it.
It is
when I looked on the internet, yes.
Fine, thank you. Okay then, so that's the only place in Mansfield then. That's right. Okay. Now the other thing is a question about track and trace and whether test and trace and whether you think it's working effectively enough for you to do your job. I know there's issues in some areas. I wonder whether it's something that you're grappling with, and whether you've started to get the information that you need in terms of test and trace. And then lastly, as a comment about the Outbreak Control Board and the membership of that board. And I'm glad to see that you have 2 district council representatives on that board, the leader of Bassett Law and the mayor of Mansfield, which is useful. But it's how we garner local knowledge from local elected members. And when I say locally elected members, I don't mean just district councillors, I mean county councillors as well, because we all have valuable information that we need to put in. And I want to be sure that we're also getting the information back from that board, because I know one of the things that the representatives have to do on that board is to engage local communities and local members. And I'm worried about the county councillors being out of the loop in all of that. So that needs to be a bit more specific. And also, I suppose it's important because elected members are able to get quite a lot of local knowledge that you would find useful as well. And again, I know we've discussed this before, and I wonder whether you've given any more thought to some kind of mechanism to garner that information, what you call soft information, but no less important. So there are my questions, Chair. Thank you.
Thank you, Joyce. Jonathan, please.
Thank you. So a couple of parts of the question. First of all, picking up questions about test and trace. So I think I might comment on the effectiveness and adequacy of that in 2 ways. First of all, again, it's fairly well publicised that the effectiveness of this in terms of being able to make contact with people to identify contacts and make contact with them, communicate with them so that you're able to give advice. There remains some limitations around that, and I think they're the limitations of how much someone on a telephone can actually achieve, particularly when that might be undertaken in business hours and someone might be out at work or otherwise busy. There is some work underway nationally on that to explore whether where test and trace has failed to make contact with someone, whether those individuals, if you like, can be passed to a local area, that would be my team, for example, for us to follow up locally. That's been undertaken recently in Leicester City on some scale. And colleagues in my team attended a call yesterday where we were starting to get the benefit of that learning. And I think we may well see in the coming weeks that turning into something which happens across the country. Now, that would, I think, increase the effectiveness of test and trace in one degree. It will also, of course, mean that we need to resource up locally to undertake that ourselves. I'm not in a position to tell you that we can do that today, but that's I suspect is a direction of travel for us. The other way that I probably need to comment on test and trace is in terms of the data which comes through from it. And I think the best way to summarize this is by saying that although the data coming through is not perfect, it's much better now than it was a month ago. So the quality of the data is better, and it's also now coming through to us more frequently. That means that my team of analysts are now able to make better use of that in terms of the analysis of that which they bring to our daily outbreak cell. So it strengthens what we can do on a daily basis in terms of our surveillance. Now, is it everything we want? No, not yet. It needs to be improved further, but we're on a good trajectory there in terms of how it's enabling us. Your other question, I think, was in terms of how we can get that soft intel from local members, indeed whether they're district borough members or county council members. In terms of district and borough members, the arrangements that we're putting in place at the moment with environmental health colleagues from districts and boroughs, I think will probably provide district and borough members the best way of getting their soft intel fed into that daily outbreak cell meeting. So as we speak, invitations have gone out to ensure that we've got environmental health officer input at the COVID-19 Protection Board, and also to ensure that those officers are able to put input on a daily basis to an environmental health officer who would represent them and feed that information into the daily outbreak cell. And then Joyce, if I was to speak to your question then about how we also secure that properly from county councillors, I need to put in place a similar arrangement, but I think that will be feeding that into one of my team, and I just need to make sure that we publicise to county councillors what that point of communication is, and I haven't quite got there yet, but intend to very shortly.
Thank you, Jonathan. I've got Sarah Collis, Councillor Shaw, Councillor Wheeler. Councillor Wheeler will be the last speaker as we want to try and keep to time. So Sarah Collis, please.
Thank you, Chair. Just to follow on, Jonathan, from what you just said, and obviously the question from Councillor Bosniak, I would really welcome a review of some of the membership of some of the boards in light of what's been learnt over the last few months, just to ensure that we've got the right people in the right places. And obviously Health Watch has got a particular stake in the experience that patients and relatives have been having throughout this, and we're not really plugged in any way. So I'd really like us to see how that can be expedited to involve Health Watch. My main point really is following on from Councillor Guilfoyle's comments around Bassett Law, and I think there's a real flashpoint starting to build in that we're now coming out of shielding for many people. They're out in the community for the first time and starting to learn to understand how it all now works. We've got, you know, further reduction in our restrictions, so that those relaxing of social distancing messages, I think, is something that I'd like to see where in our communications plan for this control plan we start to look at targeting communications with those vulnerable people that are coming out of shielding, looking at people who have got vulnerable characteristics, particularly those where communication is a major issue. I've appreciated that there's information on the County Council's website for people who use BSL, but it does then relate to people needing to have IT literacy to be able to get onto websites to use that. And I do think there's been quite a need for the deaf community, particularly BSL users, to understand that. Testing information, I think it was really interesting in the initial report that was sent last night, looking at the gender split between those that are getting tested, and it's majority women to men, even though we know that men face some of the more adverse impacts of COVID, and looking to see how we can communicate with our communities and our gender within our communities to ensure that men are getting tested as well as women. Obviously, it's a notorious issue. I think most of our clinicians will appreciate that men tend not to go to the doctors as readily as women or look at health things, but I think that's another area that I'd like to see addressed within the comms plan. And finally, in terms of, I just think what my last case was. Yeah, sorry. It was mainly around reviewing the HAG and other groups and the governance structure to ensure we've got the right people in place now that we've learnt a lot, and always do we need to review that, and the communications plan. And I'd really like to see this come back to us as a communications plan coming back to the Health and Wellbeing Board, so that we can look at that to see where gaps exist, and particularly how it speaks to the different communities around Nottinghamshire and the very different needs that we've got, particularly in the north, which is very much aligned to South Yorkshire, where we do see some worrying trends in terms of the numbers in that area, and I would hate to see that start to drift into Bassett Law. Thank you.
Thank you. Jonathan, please.
Yeah, thank you, Sarah, for those questions and the prompts. And you're quite right in the observation you make about concerns that arise as we relax the measures that have been in place progressively. It is important that we are able to relax those measures, because we all desperately need our economy to get back on its feet again and to be able to flourish, and for people to get back to school, but at the same time to do all of that in a way that remains safe and stops the spread. In terms of your specific suggestions, thank you for those prompts. I noted 2 or 3 of them, and I will pick up with the help of Ed, my officer, afterwards, to make sure that we start to build some of those into the comms strategy. So thank you for that. On one specific point, you mentioned about targeting communications to those who are coming out of shielding, and what I can say is that the Humanitarian Assistance Group at the Local Resilience Forum are currently looking at precisely that, and whether there is a follow-up communication to be made to those people even now, to reiterate to them what further support they can continue to access through the community support hubs, even though the shielding, some of the other arrangements around shielding is changing. So thank you for your prompt on those. Yeah, that'd be something to be pleased to speak to in the future with the agreement of the chair.
Thank you. The next speaker is Councillor Shaw, please.
Yeah, thank you, Chair. Thank you, Jonathan. Really great presentation. I've just picked up a few comments, and I just want to mention about follow on from what Sarah's just said about the deaf community. We had a presentation from the deaf community at the Retford Business Forum, and the fact that the masks are stopping the deaf community from communicating because of, obviously, they can't lip read is a massive problem for them. And I think it probably we haven't done enough work on that just generally. I'm part of the Doncaster Ambassador Trust, and they're going to start using that immediately in hospitals where they identify people from that have that disability, where they can go in. But they're going into shops and finding it really challenging. So I just wanted to add to that. My main question is about the self-isolation and the test and trace, about the people that may be on 0-hour contracts or have no access to finances if they are highlighted to self-isolate. And I just wonder if within this amazing structure that is set up, whether we've got the opportunity to help, and I don't know what we do for those individuals. So that was another thing. And I just wonder also in the amount of work that you and your team are clearly doing under this COVID, is when we come back to like building better than we did, and Health and Wellbeing Board, how are we going to start to get back to some sort of new normal and look at some of the crisis that we will have for children and vulnerable adults and the BAME community, and how we're going to slowly but surely get this work started, given the pace of work that you and your team are currently working at. Thank you.
Thank you, Councillor Shaw. That's an excellent point regarding people who are hard of hearing. Thank you for making that point. Jonathan, please.
Thank you, Councillor Shaw. The question about people on 0 hours contracts and similar without access to finances, I think is a really important one. I think it probably points us back to the work of the Humanitarian Assistance Group and the role of community support hubs. Not that they are in a position to replace income lost, but the role that they may well need to play ongoing in terms of, for example, provision of emergency food, for example. And I think that that's something that you know, we continue to look at under the wider remit around local outbreak control planning. The question around, I think there was probably a more general question that you were pointing towards around the consideration we give to the wider impacts of coronavirus. And I think there are very properly a number of different aspects to that. You mentioned about, to pick up one specific, about the impacts from people from BAME communities. That's something which properly has received attention nationally, most recently in the publication of a report by Public Health England, which reiterates some of the very rather stark inequalities when it comes to looking at mortality for people, first of all, from disadvantaged communities in general, the inequalities that obviously exist around age and the burden which falls on older people, but also the inequalities which exist in terms of ethnicity. That is something which the County Council is turning its attention, and I've been asked to identify what the County Council can do in terms of picking up locally some of the recommendations that are made in that report. I think there will be some things we can do as an organisation. I think there will be a discussion that we properly want to bring back to partners in the integrated care system, and indeed and possibly back to the Health and Wellbeing Board as well, to make sure that we're approaching that in a joined up way, because some of it can't actually be tackled just on an individual organisational basis. You're right, there'll be other work that we need to attend to about some of the indirect consequences of coronavirus, and we're at the very earliest stages of doing that. And I think across the system, there's a bit of a balance to be struck about having to move out of recovery and get things back to normal on the one hand, whilst there are sections of the health and care social system and beyond that is still dealing with response and preparing for the winter ahead. And I think you hinted at that in your question. Probably other than that general comment, I'm not sure I can provide something more specific right now.
Thank you, Jonathan. The next speaker I have is Councillor Wheeler, please.
Hello, thank you. Thank you. Very comprehensive report. Very welcome. Thank you. I just wanted to put some context on children and young people, which was mentioned earlier. I've actually been working throughout this period with young people, either in school or out in youth and community settings. Most of the youth work being detached. And the one thing I have noticed in terms of children's mental health and emotional wellbeing is that it's a mixed picture out there. Because for some children, parents have said that those children that haven't been in school, they've actually seen an improvement, particularly for those who've had school phobias or have been reluctant, school refusers. There's been an improvement in some of their health issues around mental health. But then for others, there's been quite a serious deterioration in mental health, particularly with young people who are used to socialising and being with friends in school and so forth. The questions I've got actually relate to schools coming back in September, because on page 34, item 14.7, there's potential challenges and mitigations. What I'd like to raise is the issue around schools acting independently and the risks associated with that in terms of their behaviour policies, particularly around school uniform, the issues around vulnerable young people that have disabilities that will be coming back into school, but also around staff that have been isolating or very vulnerable with underlying health conditions coming back in September. Because there's going to be a mixed picture. I know some schools in their behaviour policies are saying that, particularly in the secondary settings, are saying that children won't be allowed to wear masks in schools, but they'll be coming in with masks because quite a few of them will be coming in on public transport. And the issue I've got is that some parents will be reluctant, I think, in September to send their children back to school particularly if they're being told they can't wear masks in a setting where actually there's going to be quite a lot of people in confined spaces, classrooms. Staff are being told that they have to social distance, but you know it's going to be quite difficult social distancing depending on what your role is within a school or educational setting. So I was wondering what can be done to sort of reassure parents around sending their children back to school, but also I was wondering what was going to be done around helping vulnerable staff and vulnerable children that might be returning to school in September in terms of you know, reassuring them and making the environment safe. I know that some schools have done risk assessments for individual staff, depending on the conditions such as asthma and so forth. But I think there is a serious risk also that with some children going back, I know the government's saying that they might fine or looking at fining potentially children that don't go back to education. But I think the issue around masks needs to be looked at. The issue around protecting those who are more vulnerable within the school environment needs to be looked at. And there's lots of unanswered questions around schools and how they develop their individual policies around going back in September. So again, as I say, my question is really, what can we do to try and get things right for that period of time? Thank you.
Thank you, Councillor Wheeler. I'm going to ask the Corporate Director for Children, Colin, if he would answer this one, please. I think it's more your department, and if Jonathan wants to chip in, that's fine. Thank you.
Thank you, Councillor Harper. And it would be remiss of me not to start off by saying to Councillor Wheeler, with his other hat on, kind of my gratitude for the work of all of our youth workers over the last few weeks and months. Our youth workers have, as people will know, universal youth clubs have had to close, but our youth workers have very much been at work and very much been in the front line, been in our children's homes, been in our been in our schools and been on the streets and the parks that one of the members of the board referred to earlier. So if I could thank you and your colleagues, and I know that you know that from social media, but thank you very much, Councillor Wheeler, for your work in that area. We are extending our youth offer this year. Youth workers will be working over the summer. We're very alive to the risks that Councillor Wheeler has highlighted. I would suggest, Chair, that you might ask for a report to go on the forward plan that might look at the how the return of children, particularly with regards to the emotional health and well-being, has occurred. I would suggest probably towards the end of the autumn term. So maybe the December time would be worth doing that. We're looking at new ways of supporting children and young people. Our young people, when we've done surveys, have talked about the use of social media and the use of new technology in supporting their emotional health and well-being. And I think we often think of that technology as being a risk to children, and it undoubtedly is. But there are some significant benefits, and the use of Couth, for instance, in terms of online support for young people. Our schools, our secondary schools, 46 of those, 45 of them are independent of the local authority, and it's right for me to point that out. But we have worked more closely with those academies in the last 18 weeks than we've done probably in the last 5, 6, 7 years. And it has felt, I have to say, almost like the Every Child Matters programme is back, and schools have taken a very rounded view to supporting them. But we have to remember that in the main, in the last 18 weeks, it has been primary schools that have had pupils over their doors, either because the critical workers or vulnerable children and critical workers, older children of secondary age, have often not needed to be in school for childcare. And it was years, let me get this right, reception years 1 and years 6 that returned to primary school, and very soft touch for years 10 and 12 in the secondary sector. And so this will be a challenging time, I think, for many young people and for staff coming back. We're very alive to that, yeah, and we will be kind of monitoring it as well as responding to it.
Thank you, Colin. Jonathan, do you want to add anything to this, or are you okay with that?
Nothing to add, thank you.
Thank you very much. Last speaker is Councillor Butler, please.
Thank you, Mr. Chairman. Well, as colleagues have said, the amount of work and information that's gone not just into this report, but in general over the last few months now, it mustn't be underestimated. It's quite phenomenal. So well done to Jonathan and all colleagues who are working on this. And also, we've just been talking about schools. As a school governor, I've just seen myself firsthand just the impact on the management and the planning that the schools are having to do as well. So I don't underestimate the amount of disruption it's caused to what we were all planning perhaps at the beginning of the year. But with regards to this report, perhaps on the communications side of things, we hear a lot about the asymptomatic situation where a lot of people may have COVID but not show symptoms as such. And as we've seen that the figures in Nottinghamshire are fortunately relatively low. I mean, one's too many, let's be honest, but compared to other parts of the country, is relatively good. Is there a danger of some complacency coming in from everyone that oh well, it's not such a problem now, but as I say, people may have the disease and not know it. So will communications help emphasise that point and perhaps remind people that they still have this responsibility for social distancing, etc.? Thank you.
Thank you. Jonathan, please.
Thank you, Councillor Butler. The answer is yes, you're absolutely right. It's really important that although Nottinghamshire County enjoys rates of new cases which are lower than in many parts of the country, that we're all continuing to exercise discipline around that social distancing, self-isolating, the hand washing, the respiratory hygiene, and so on. We don't currently have a substitute, anything else that we could put in its place, which would deliver the same kind of protection that we need. So whereas we might from time to time hear about the role of testing or this or that measure, those things have their place, but they're not a substitute for keeping going with the social distancing and the other things. Now, I'm aware, as you are, that that keeping going with some of those measures in the context where there are there's a certain relaxation of some aspects of the measures, that's not simple. It ends up we're ending up in a situation where there are sometimes some complex or nuanced messages that need to be given. But I think you're right, Councillor, to bring us back to the importance of making sure that all of our communications underline those ongoing important disciplines that we all need to continue exercising, and we need to find ways of doing that. I just need to check with you. Did you have a question about testing more specifically? I might have missed something.
No, not particularly. My main question was about the date. Are we aware and thinking about the potential danger of complacency coming in? Okay. Because people read and hear maybe there isn't a big problem in Nottinghamshire, but people may have it without showing the symptoms. And you've answered the question.
Okay, thank you.
Great. Thank you.
Thank you. Interestingly, Councillor Butler, the school I'm a governor of, we're still on weekly meetings every Friday morning to try and get everything sorted out. Before we leave this subject, I've got Councillor Fisher who's made a comment. Can I ask if track and trace centres are set up? Can local district councils be notified, as Mansfield wasn't when the last one was set up? Jonathan, please, just a quick answer on that one, please.
Yeah, I think we're probably talking about mobile testing arrangements, and the answer to your question is yes. And when we did this in Bassetlaw a couple of weeks ago, although there were a new set of lessons to learn from that, we were pleased to be in touch with colleagues within Bassetlaw District Council at an early stage to make sure that that was done in a sensible way. Thank you.
Thank you. Thank you everyone for all your input in that. That was really interesting. I've read out the recommendation, which is on page 13 of your agenda pack. Is anyone against it, please? Thank you. I'll take silence as assent, and we'll now move on to item 8 on the agenda, which is pages 75 to 98 on your agenda pack. Adult Social Care and Public Health Committee presentation of report. The purpose of the report is to review of the Better Care Fund programme and use of Better Care Fund reserves for short-term transformation projects. The recommendations are set out on page 80 in your pack, and I'll now hand over to the Corporate Director for Adult Social Care and Health, Melanie, please.
Okay, so before I introduce Wendy, who will just summarise the recommendations, I thought it might be helpful to give a bit of a context. I know some of you have been around the Better Care Fund, Adult Social Care and Health and Wellbeing Board for many years, but we are a sort of newly constituted membership. So just to summarise really, the Better Care Fund's been with us for around 7 years. When it was formulated, it was made up of a mix-up of existing funding streams and grants to district councils, county council and the NHS. So it wasn't a new investment of money. Over the years, we've had a number of temporary funding streams running through that. And if you recall, for many of you, it's given us quite a lot of headache and heartache because we are often reporting on the temporary nature of the funding of core adult social care functions. So since I think we've last convened as a Health and Wellbeing Board, there's been a review of the Better Care Fund, given we now have had confirmation it's going to exist for a further 2 years. We've also had confirmation in the spending round last year that the adult social care funding is part of my base budget now, so that funding has been confirmed as permanent, which I think is a big step forward. And we've also had further development of the integrated care system and the integrated care partnership, which has led to the CCGs wanting to think differently about how they fund joint work and the context of the Better Care Fund. So that's led to the recommendations there, but I thought a little potted history might be helpful to you all. I think the other thing just to note, we're not seeing the performance report today, but the other thing to note is that the targets that were given to local systems when it was first started were always seen as ambitious and unachievable in the face of overwhelming demand in the urgent care system. And I know that's been a thing that's always taxed members, is why are we permanently scoring red on our admissions to hospital. But I think it's fair to say the Better Care Fund has driven some partnership work in, maybe not in the way it was intended, but certainly in the time that I've been with Nottinghamshire, we've made some really good progress on certain aspects of it. And particularly are working around with district councils in the housing, health and care space. So just with that in mind, I'm going to pass you over to Wendy, who's going to sort of briefly summarise the rationale of the report.
Thanks very much, Melanie. Thank you very much for the time to give some further detail about the review that I carried out. There is evidence given about the review itself in Appendix 2, if anybody wants further detail, if you haven't managed to look at that yet. The purpose of the review was, as Melanie said, to look at the effectiveness of the BCF steering group, which works underneath the Health and Wellbeing Board to guide the programme, the BCF programme in Nottinghamshire, to clarify how our outcomes compare, to explore how the programme relates to the Health and Wellbeing Board, and set out how well we're meeting our duties to integrate service provision and make recommendations. So I'd like to draw your attention to 2 key findings from the review before I just highlight the recommendations. Firstly, in relation to the role of the Better Care Fund steering group in Nottinghamshire, as Melanie pointed out, it has done very well driving change in one particular area, which is around the relationship with housing and consistency in the use of the Disabled Facilities Grant. And it's performed well as an administrative mechanism to manage the finances and report on performance. However, in the findings of the review, it became clear that there isn't a very clear understanding across all partners about how the funding is spent in the different agencies, and there isn't significant debate about the use of that spend other than in relation to the Disabled Facilities Grant allocation. So there's a lot of focus on that. there are, as Melanie said, some really good examples of how we're integrating services and commissioning services jointly, but none of the outcomes of those services and projects are routinely shared at the Better Care Fund steering group. So we're not learning from our successes, reflecting on how things could be going better. And there isn't any sense of holding other organisations to account at the moment when things perhaps don't go as well as we want or performance is low. In relation, secondly, a key finding is that, as you are aware, one of the 5 legal duties of the Health and Wellbeing Board is to promote the integration of services. But there aren't, other than the BCF steering group, there aren't any work streams under the Health and Wellbeing Board which are focused on driving forward the integration of services across health and social care particularly, or driving the partnership that we need across housing, health and social care as a whole. So these seem to be clear gaps. Clearly, integration of services isn't an end in itself, of course, and it's possible to have vigorous debates about what integration actually means and how we know when we've got it. Nevertheless, it's commonly recognised that where health, social care and housing duties overlap, we should be working together as closely as possible in order to prevent duplication of effort and resources, help staff from different organisations to understand each other's roles, trust each other's expertise, and make good decisions about how best to support people with complex needs to stay independent and well. We should be making it easy for staff to share information so that people aren't having to tell their story over and over again or having multiple assessments from different staff. Some service areas where this is particularly relevant includes supporting people to have good discharges from hospital, supporting people in the community, and where people need joined up support to recover from a crisis in health or care. So the recommendations particularly speak to this. And referring to paragraph 13 to 16 of the report, you'll see that the first recommendation is that we should be developing a clear strategic vision to explain what we mean by wanting to deliver services that work in joined up ways across housing, health and care. And we should do that in co-production with people who have experience of those services to date. The BCF steering group did agree that there were 3 priority focus areas where we could perhaps achieve some quick wins, and those are set out in the report, particularly around assistive technology, digitisation to help share information across housing, health and social care, and also to focus on the housing pathways that we need to support effective and speedy hospital discharge. And finally, that we renew the way that we do business together by establishing what would be 3 subgroups under the Health and Wellbeing Board. Firstly, one to focus particularly on the integration of health and social care in those service areas where it's particularly meaningful and important that we achieve integrated approaches. Secondly, that we establish a housing partnership which thinks about the breadth of ways that we can work together where people have housing needs and related health and social care. And finally, that there should be a BCF business group which administers the fund and makes sure that our reporting targets are met consistently in line with national guidance. So that's the first part of the report, which is mainly about the review that was undertaken. Paragraph 17 to 19 set out how our partnership response to the COVID-19 emergency has increased our adoption of integrated approaches with significant success, and we should be keen to build on this experience. And finally, paragraphs 22 to 26 explain that a reserve of 2.6 million has been built up over the last few years from the County Council's BCF allocation. And so a set of 16 short-term transformation projects are being proposed to utilise the majority of this reserve. the projects all meet the criteria set out for the use of the County Council's BCF allocation and reflect the direction that Adult Social Care and Health Department wants to take as services move into the recovery phase. And the final paragraphs, 27 to 28, explain how BCF related work has continued during this emergency period. Thank you.
So just to add, we're not proposing lots of different new groups. Sort of in the way it was presented, it sounded like we would want new things. We're proposing that we're changing the existing mechanisms and standing down a number of the groups that are in existence. I think it's just a note to say that we're fully behind the development of the ICS and the ICPs, but given this Health and Wellbeing Board spans two existing health systems, the South Yorkshire Batelor ICS and the Nottingham and Nottinghamshire ICS, and the chair of the Health and Wellbeing Board is a member of both of those. What we're instead saying is about this ability to steer that work. So it's not trying to set up extensive new structures, but more trying to focus the existing steering group in a different way. So hopefully that that's helpful.
Thank you very much. I've got two speakers at the moment. I've got David Ainsworth and Councillor Bosniak. So David Ainsworth, please.
Yes, thank you very much. So David Ainsworth, Locality Director for the Mid-Nottinghamshire ICP. And just to say in brief, I really welcome this report, and particularly the point that Wendy you made around the integration of social care with health. We know, don't we, from the Marmot review and as a direct result of COVID, the gaps in health and care provision are likely to have worsened. And so anything we can do at an ICP level, frankly, will only start to address those gaps. So really welcome it, fully supportive, and look forward to working with Wendy and Sue Batty and colleagues on actually implementing that integration. So thank you.
Thank you. Wendy, do you want to comment on that one, please?
Yes, thank you. I've had quite a few years working in Mid-Nots with David's support and other colleagues from the NHS across providers and commissioners, and I'm really clear about how much more we can do. We've made some good progress, but certainly by rolling out consistent approaches and learning from where things have gone well, we can take this a lot further. Thank you, David.
Thank you very much. Councillor Bosniak, audible only, please.
Thank you. One, I'd like to thank Wendy for the review. The way you put it across has been quite straightforward and easily understood, and I think it was well overdue. I also like to thank David for his comments as well about his enthusiasm for integration between health and adult social care. It's quite nice to hear that, because we talk about it a lot, but it sounds as though you actually want to get in there and sort it out as well, and I'm really grateful for that. The only disappointment I have is when Wendy spoke about the need to deal with assessments, because I understood, because we've been talking about assessments for a long, long time, that rather than everyone going and asking individuals to give us their history about what they've done, about their health history, etc. We've been saying for years now that we want one assessment that everybody can utilise. So I am disappointed to hear you say that we still need to do that, because I thought we were well on the way. So hopefully you'll give it a fresh impetus, Wendy, and make sure it's done. And then the other thing that I think is an ongoing problem, and a bigger problem that I think we can address, and that is about housing. Because it's all very well getting people out of hospital, but where do you send them to? And I know there's a backlog, that's a terrible expression, but I do feel as though the system is clogging up because we just don't have the housing stock that is suitable for the people leaving hospital. And I know we have a massive homeless problem in some areas in Nottinghamshire, and when they start to look for accommodation again, when the hotels have stopped housing homeless people, it's going to be a massive issue that I think needs addressing, and I'm hoping that the housing partnership will go some way to addressing just that. So thank you for a really positive review, and just that little niggle about the assessments. Thank you.
Thank you, Councillor Bosniak. Good point there. Wendy, would you like to come back on that one?
Thank you, Councillor Bosniak. I fully appreciate what you're saying. I think I was trying to convey the frustration that people rightly feel when they perhaps meet an OT from health and then have a similar discussion with an OT from social care, where they're being asked the same questions as part of an assessment to understand what can help them to stay independent in their own home. That is still happening at the moment. We need to join up the way that we organise our services so that we reduce those kind of duplications and that we don't give people that sense that we're not working together. There's a lot that's been done to help staff on the front line see each other's work and health records. For example, social care staff can now look at a health and care portal to see details that are available from primary care as well as hospital, to try and minimise staff having to ask the same things again. There is certainly an intention that we bring that together even more to create what might seem like a single assessment service or a single assessment profile, where we all contribute the information we're collecting into one source so that different staff have access to it.
Thank you.
If I may comment on the housing question, Councillor Harper, before we move to the next question, if that's okay. So I agree, Joyce, wholeheartedly. I think housing is one of our key risks as a county going forward. We've had great success through the Local Resilience Forum, the LRF, in having a cross-county approach to tackling the guidance coming down from MHCLG about everybody. Is it everybody in, all in? I can't remember the name of it now. It's gone out of my head. But the initiative to support RAS sleepers through COVID. We also know, you'll have heard from Jonathan before about the pressures on refuge accommodation for domestic abuse. We have people who are unable to get accommodation to move out to enable more people to move in. We also know from adult social care that we're struggling to get housing support for people who would be priority housing, such as older people needing to move home or people with disability and mental health issue. So I'm really hopeful that through the Health and Wellbeing Board, we can start to take quite a cohesive approach to that, because I know it can be quite difficult in a housing authority, seeing the benefit of working with others when services and housing supply is under such pressure. But that is one of the areas I think we really need to give some attention to. It's a big risk for the county, I think, going forward.
Chair, can I ask that, particularly the housing, is that we look at that at future meetings as well, just to keep an eye on that, see what we can do to help. Thank you.
I'll ask the officers to put it on the work programme. Good point, Joyce. Thank you. The last speaker I've got is Councillor Shaw. I'm hoping we're still going to finish on time. So Councillor Shaw, please.
Okay, I'll be quick. Thank you. I think I would have liked this. I'm assuming this report has been done sooner than us getting together as a Health and Wellbeing Board, and I would have liked the papers in advance to consult with my colleagues in the district. I mean, one of the things we were talking about is it's really great a report, and thank you. And I think some of the changes are really good, but we're just concerned that in Bassett Law, the additional pressures we've got around rough sleepers and discharge from hospitals, and I know that's what you're talking about, but as long as that funding is, continues and that Bassett Law gets its share. So that was the other thing, and I'm just looking at recommendations about developing a vision. Who's developing the vision? I'd like to know who's developing the vision, if it's us in the whole of Nottinghamshire, and the timescales for that, because to me it seems just a little bit vague. But generally we're happy with it as long as we get some money and the communication and partnership work continues for Bassett Law. Thank you.
If I may, Wendy, answer that bit about the vision first and then pass over to you about the housing. We did have a workshop scheduled, if you recall, for April for Health and Wellbeing Board, at which point we would have developed the vision, but unfortunately we weren't able to proceed with the meeting. So we would be looking to reconvene that workshop session.
Yeah, and we'll pick it up as soon as we can, I can assure you. Wendy, did you want to add anything?
Actually, I was going to say the same thing. In terms of the allocation of the DFG money to the districts and boroughs, that's all set nationally by formula. So it's passed through from the county council. So in terms of allocation, that's all done as fairly as anyone might agree with the weighting calculation.
Lovely. Thank you very much. You're getting a lot of nods on that one, Wendy. So that's the end of this item. You've seen the recommendations which are on page 8 of the report. Anyone against? If not, I will take it as a send. Thank you very much. We'll now move to item 9 on the agenda, which are on pages 99 to 106 on your agenda pack. Update to the Nottinghamshire Pharmaceutical Needs Assessment. The purpose of the report is to seek approval for the publication of a supplementary statement to update the Pharmaceutical Needs Assessment, that will be known as PNA 2018-21 for Nottinghamshire, based on changes to services from October 2019 until March 2020. And it's to provide an update on the requirement to produce a refreshed PNA being delayed from April 2021 to April 2022 due to COVID-19. The recommendations are in your pack on page 101, and I'll hand over to Jonathan, please.
I'll go straight to Lucy, if I may, please, Chair.
Yeah, by all means. Thank you, Lucy.
Thank you, Chair Jonathan. So our current P&A was produced in 2018, and this describes the pharmaceutical services across Nottinghamshire and whether those meet the needs of our local population. We then produce the supplementary statements quarterly, and that is to outline any key changes to services. So you can see in Appendix 1 the latest supplementary statement, which is from October 2019 to March this year. Most are slight changes in hours, and then we've got 2 closures on there. We don't believe that these create any significant gaps. As Chair mentioned, we also wanted to make the Health and Wellbeing Board aware that due to the COVID-19 situation, the Department of Health and Social Care have actually delayed the requirement to publish a refresh P&A from April 2021 to April 2022. So that gives us another additional year to prepare for that. We did have some initial steering group meetings, but we've postponed those until later this year to align with this new timescale. So that takes me onto the recommendations, which are that the board approves the supplementary statement from October until March. The next supplementary statement will be brought to the board in January, and that the Health and Wellbeing Board approves the planned approach to the 2022 refresh with a more detailed paper outlining our project plan for that, brought in mid next year, once the steering group has re-established and developed this. Thank you very much.
Thank you very much, Lucy. Any questions, please? I've got no hands up. If there are no hands up, is anyone against the recommendations, please? I will take that as an assent, so that has been passed. So item 10, and we're still in line and finishing on time. Item 10 is the work programme. To consider the board's work programme for 2021, the County Council requires each committee, including Health and Wellbeing Board, to maintain a work programme. The current work programme has been disrupted, as you would expect, by the COVID-19 pandemic, and we would like to reassure members that work is underway to reprioritise the items, and we intend to provide an updated work programme for discussion at the next meeting of the Health and Wellbeing Board. Could I just bring in Ed, please, just to make sure you've got the 2 items that we've mentioned at this meeting?
Hello, Chair. Yes, I've made a note of those. We'll be speaking to officers next week to try and re-establish the work programme in line with items that hadn't taken place due to COVID-19 and those new suggestions as well. So hopefully we'll be able to be in touch with members very soon on a revised version.
Yeah, I've got Councillor Guilfoyle, but before I bring in Councillor Guilfoyle, and I've also got another speaker, I assume that probably the next meeting will be a formal meeting again, not a workshop, because we've got business we need to catch up with.
Yes, the normal pattern does tend to alternate between meetings and workshops, but I think due to the number of items that have been suspended, I think perhaps a regular series of meetings for the time being might be best.
Thank you. Councillor Guilfoyle, please.
Yes, Chairman. I just wanted to comment on the meeting. I mean, it took a long time for this meeting to actually be put back on the agenda again. And I think that today's meeting has proved how invaluable this meeting is for both members of district and public health authorities right across. I mean, I've learnt a lot today from what's been said, and there's been some very important items that we've dealt with. And also, I think there's been some very good local intelligence that's come out and helpful comments from members right across the board that probably would have assisted with some of the work that officers were doing with COVID-19 earlier on in the year. So I think it's been a mistake not to have this meeting. It's not been painful. I don't think people could say it's a meeting that's a painful meeting. And I just want to know exactly when the next meeting is going to be, because you know, this is an important agenda for the people out there, and clearly, you know, there are some key players right across the board who are sat around this table. So when is the next meeting going to take place, Chairman?
Yeah, thank you for your comments, Councillor Guilfoyle, and hopefully everybody else feels the same way about it. I've really enjoyed it. I think we've had good debate. I think we've had a lot of information passed to us, and I agree with you, the fact that it's not been before now, but the next meeting, the next scheduled meeting is the 2nd of September, so it's not long to wait for that one. It'll probably be the first county council meeting to take place, because we normally come back in September, so that will be a business meeting, because like you say, obviously we've got work to catch up with. So thank you for your comments. Councillor Bosniak, please.
Yes, just to go back to the work programme, one other thing that I was thinking about is the impact. We've been talking about the COVID virus, but I'd like to know what impact it's had on ordinary health, other clinical interventions. So I'd like a report on that, about, you know, just how many cancer treatments have been cancelled as a result of COVID, that kind of wider issue. And I wonder whether that information could be available for September, or at least a report about it and how adversely affected the rest of the health sector has been impacted by the coronavirus.
Yeah, thank you, Joyce. That's a really good point. Ed, are you able to do that for the next meeting, please?
I can certainly look into it. We'll certainly add it to the work programme, and I'll be in a discussion perhaps with Jonathan about how best we can implement that.
I can see Dave Ainsworth nodding, so perhaps we can make that happen, Chair.
Lovely, thank you, David.
Yeah, thank you. Could you keep me in the loop as well, please, Ed?
I certainly will.
Thank you. Councillor Fisher, please.
Hi, yeah, I just wanted to extend my thanks to all of the County Council staff and District Council staff over this period. I know I can only speak for Mansfield, but we've had such fantastic staff support, and the work that they've done behind the scenes in changing the job role that they've been doing, from whether it be on parks or to litter collections or to giving out the food parcels. It's just been absolutely amazing, and I'd just like to send my thanks to all of them for that.
Yeah, thank you very much, Councillor Fisher, because everybody has stepped up to the plate. They've done a fantastic job, an amazing job. It really takes me back when I see how people have transformed and doing the best for the community, and that's what we're all about. So that's really good. And thank you, everybody, as well, for your input in today's meeting. Obviously, we've only been here virtually, but it's been lovely to see everybody, and really good to see the enthusiasm from everybody. And hopefully we're going to have some good meetings coming up. So please stay safe, and I'll see you all at the next meeting. Thank you very much. The meeting is now closed. Thank you.